Quality Assurance of Medical Education in Georgia. This video outlines how the quality of MD programs is assured across the country by the National Center for Educational Quality Enhancement of Georgia. Undergraduate medical education is regulated by the law of Georgia on higher education. Postgraduate and continuous professional development are regulated by the law of Georgia on medical practice, which aims to ensure appropriate professional education and practical training of independent medical practitioners by introducing nationally recognized medical and ethical norms in medical practice. After completing undergraduate MD programs, students can undergo residency training, which is a postgraduate stage of medical higher education. The next stage after the residency is doctoral, that is followed by continuous professional development. Doctorate in Fundamental Biomedical Sciences is an option after graduating undergraduate MD program, as well as after residency in clinical fields. The duration of residency programs is from 2 to 6 years, on average 3 years, depending on the specialization. If you specialize in laboratory medicine, minimum duration of residency would be 2 years and maximum 6 years. If you specialize in neurosurgery, the duration of doctoral studies is 3 years. Individuals who wish to engage in independent medical practice in Georgia need to pass certification and receive a state certificate, giving them permission, license of starting independent medical practice in Georgia. All MD programs undergo program accreditation based on national accreditation standards and related benchmarks for MD program. The National Center for Education Quality Enhancement, as a gatekeeper as well as contributor to higher education quality, leads the quality assurance and enhancement of undergraduate medical education across the country. For this, we have set standards and requirements for the delivery of MD programs and revised sector benchmarks of medicine in 2018. Renewed sector benchmarks aim to facilitate higher education medical institutions in Georgia in developing MD programs in line with international standards. They ensure international recognition of medical graduates and their mobility. Sector benchmarks in medicine outline requirements in terms of knowledge, skills, and attitudes that are necessary for the award of MD qualification in medicine. The document is based on the law of Georgia on higher education, law of Georgia on medical practice, global standards of basic medical education for quality improvement, developed by the World Federation for Medical Education, numbers of EU directives of the European Parliament and of the Council and international best practices of medical training. For the scrutiny and adding international dimension to the evaluations carried out by the NCEQE, we always involve international experts as chairs and/or co-chairs in our evaluations. The experts panel evaluates how MD programs and institutions fulfill requirements of sector benchmarks in medical education, as well as requirements related to human and material resources for ensuring quality of education provision for students. This involves evaluation of the degree of integration of the program, the content and scope of the courses designed to develop clinical and scientific skills, the assessment of how the students of MD programs achieve competencies defined in the sector benchmark document, the relevance of teaching and assessment methods. We expect that teaching methods, among other, should include problem-based and case-based learning and practice of case-based clinical reasoning. It is recommended that evaluation methods include objective structured clinical examination, portfolio, mini clinical evaluation exercises, objective structured practical examinations, etc. As part of Georgia's commitment of having its external QA standards of higher education internationally recognized, we underwent external evaluation by the World Federation of Medical Education and received recognition from the WFME. For Georgian higher education, it means staying up to date with the best practices and driving up the standards of quality improvement, specifically in medical education, as well as enabling eligibility of the graduates of MD programs in Georgia for the United States Medical Licensing Examination and employment, considering that from 2024, eligibility of USMLE is going to be restricted to graduates from medical schools and programs accredited by QA agencies, which is recognized by the WFME standards or to an equivalent standard. The number of international students has been increasing in recent years. Currently, there are 13,000 international students studying in Georgia, and the majority of them are enrolled on undergraduate MD programs. Admission of international students is a centralized one. First, students apply to the institutions, but then they are admitted to MD programs on the basis of the order of the Minister of Education and Science. Further changes envisaged for raising the quality standard of medical education in Georgia involve setting student-patient ratios for internal medicine, surgical disciplines and emergency medicine courses that will prevent affiliation of single teaching hospital to many schools.